So lying back down on the floor again, we're going to learn how to practice pelvic floor in this position, the relaxation position. It's very difficult to tell if somebody's performing pelvic floor because you can't actually see any movement externally. All the movement is seen internally. So if you're gripping your bottom cheeks or tilting the pelvis or gripping the legs or pulling the belly button in, that's all external movement we can see and pick up on. And it's movement other than pelvic floor. So lying on our backs on the floor in the relaxation position, I'd like you now to close your eyes, because when our eyes are open, the brain tends to take in visual information from around the room. When we have that visual stimulus taken away, we can home in much more on our internal environment. We're therefore much more sensitive to changes in pressure and different sensations within the body when our eyes are closed. Earlier, we talked about engagement of the transversus muscle as about 30%. It's certainly no more than that, and possibly even less when we're trying to isolate each pelvic floor opening separately. And the reason for that is these openings are very close to each other. So if we engage any one of them more than that, then we're going to drag in the other openings. And we want to learn to be able to isolate so we can feel each different part separately and then put all the parts together and feel it as one whole. It's not always obvious when you actually engage the muscle whether you've managed to isolate it or not. It's sometimes more obvious as you release the contraction, and you might think to yourself, oh, I felt my bottom cheeks release, for example. If that happens, then remember what we said earlier, less is more. So the less you contract, the more you'll be able to isolate. So next time you pull in, just contract a little bit less. We'll talk about the sphincter muscle first of all. This is the little bottom hole, your back passage if you like, that's going to draw inwards and upwards internally inside of you, as if to stop yourself breaking wind. So what I'd like you to do is breathe in through the nose, and as you breathe out through the mouth, for roughly a count of 5 seconds, I'd like you to just very gently, no more than 30%, draw in the little bottom hole inwards and upwards internally inside of you, as if to stop yourself breaking wind. So let's try that now. Take a deep breath in. As you exhale through the mouth, very subtly draw in that sphincter muscle, that little back passage, the little bottom hole, draw it inside of you by no more than 30%, and hold it for a few seconds, still exhaling. And as you release, see if you can tell if you managed to isolate it, or did you feel other parts release? How did you feel there, Hilary?
Fine.
Fine. Good. Let's try that once more time. Deep breath in, blow out through the mouth, and very gently draw in that back passage as if to stop yourself breaking wind. Hold for a few seconds, still exhaling, and then release gently and see if you can tell if you manage to isolate. We'll now move to the front passage. This is the muscle that you pee out of. So what I want you to think about here is that you're going to stop or lessen the flow of urine mid-flow. Again, it's very subtle. It's almost like a little pulse or a heartbeat, this. So you're a very subtle contraction to stop or lessen the flow of urine. Don't actually ever practice that in real life because it can cause problems or infections. So breath in now, deep breath through the nose, and breathe out through the mouth, and very gently drawing that little muscle right at the front that will hold your water, that will stop you passing urine. Hold for a few seconds and then release and let go. How did that feel, Kay? Good. One more time. Deep breath in and blow out through the mouth. Very gently, very subtly pull in that muscle as if to stop the flow of urine. Again, try not to over pull and drag in any of the other openings, and release and relax. Okay. For women only now, we'll now do the middle passage. We're talking about the walls of the vagina here. And there's a couple of things that you want to try and envisage here. Imagine an elevator, a lift. So imagine the walls of the middle passage lifting up internally inside of you. Almost like going up to the first floor where your belly button is, the second floor towards the chest. So feel the walls lifting up inside of you. Then imagine how lift doors close together. Think of the lift doors or the walls closing in against each other, almost like drawing a pair of curtains. And the action here is to draw the curtains first and then lift up second. So let's try that now. Take a deep breath in. Blow out through the mouth and gently draw the curtains together and then lift the walls internally upwards towards the belly button. Hold for a few seconds and then release and relax. Often this can be the hardest to isolate because there's an opening either side. It's very tempting to pull one or the other in. One more time, breathe in. Blow out through the mouth. Close the curtains first and then pull up. For men, you get the feeling that you're pulling up your family jewels, if that helps, okay? So now let's try all parts together at the same time. It's still very subtle, so don't exaggerate it too much and move other body parts. Take a deep breath in through the nose now. Blow out through the mouth. Pull in the back passage as if to stop yourself breaking wind. Pull in the middle passage like going up in the lift, and pull in the front passage as if to stop the flow of urine. Hold all sections tight for a few seconds and then release and relax. One more time. Take a deep breath in through the nose now. Blow out through the mouth and very gently pull all three simultaneously together. Hold for a few seconds